5, 4, 3, 2, quiet on set, 1.
Welcome back to Newsmaker Live, and thank you very much for staying tuned. We're discussing cancer. This month is Breast Cancer Awareness Month, and we have joined in that observance because of the prevalence of breast cancer. And I'm here with Dr. Owen Gabriel. He is the head of the Oncology Center at Tapio. He's also a consultant physician at Victoria Hospital. Now, breast cancer, we know that women have breasts, but most people don't acknowledge that men have breasts, and as a result they are also susceptible to cancer. Before we talk about that, let's talk about some of the conditions that might mimic cancer. You know, someone might be going crazy, oh, I have cancer, before even checking, because of some of those warning signs that you presented a little earlier.
Right.
What are some of those conditions that might mimic cancer?
So fundamentally, people with breast conditions either come in complaining of breast pain, which is a lot of people complain of breast pain, but in the majority of cases, we know that there are what you call benign conditions associated with that. Some people come in complaining of a mass, which is a palpable lump in the breast. And in other cases, you may have a nipple discharge. So in the case of breast pain, which we refer to as mastalgia, there are a number of benign conditions that are associated with it. One of those would be what we call fibrocystic condition. And fibrocystic condition is really a condition where you have an inflammatory reaction of breast tissue because of hormonal influences. So it would vary with your cycle and so on. Right. It's really an imbalance of these hormones that we have, and it might manifest as a nodular area that might be tender. And as I said, it may change with your cycle. And obviously, if that persists when your cycle is over, then it needs to be thoroughly examined and looked at. But in the most cases, it does not require real management. What you do is symptomatic management, if anything at all. And a number of people, a large percentage of people, get a solution just by ordinary means, using ordinary situations and ordinary remedies. There are other conditions that are associated with masses. One of the very common most common one is a fibroadenoma, which is very common in women below 30. And that's a very smooth mass that is round. Usually it sometimes could be tender, but probably not. It's mobile. It's sometimes a single mass. Young women have it. It's also could be associated with changes in hormonal levels, because that young person is growing up and they're developing breast tissue and so on. And a fibroadenoma is a benign lesion of the breast, and that could be confused with a breast mass, cancer of the breast. There are other things that also occur. There are questions of abscesses that can occur in the breast. You can have a cyst of the breast, which is really a sac filled with fluid, and again, draining that fluid with a needle, sort of a needle access. You aspirate that fluid, and your cyst might disappear. So there are a number of benign conditions. There are other conditions where you have a nipple discharge of different colors. You can have a cleared nipple discharge, you can have green, you can have bloody nipple discharge, you can have pus associated nipple discharge, and in some cases those might indicate a pathology, whether it is benign or malignant, meaning cancer. So a breast mass and pain are presentations of different types of diseases that might mimic a breast cancer. However, we know that in the majority of cases, somebody with breast cancer does not present with pain. Does not present with pain. In the majority of cases, you have a painless mass, and something like only 20% of people actually present with pain when they have breast cancer.
Why is that though?
And that means that breast cancer has now affected pain receptors in your skin.
I see.
In where there are nerve endings on your chest wall, in the nerves along your chest and your muscles and so on. Normally there's hardly any pain with breast cancer. And then, you know, obviously, when that cancer presents, and we say in St. Lucia, I would say, in my experience, over the last 8 years, that 8 out of 10 persons that I see with the breast cancer present in an advanced stage. And that advanced stage would mean a stage 3 or even a stage 4. We say, and when we explain this to people, we say that there are 5 clinical types of breast cancer. The 5 include what we call lobular carcinoma in situ, and you know, the breast
I'm sure you'll break that down.
The breast tissue is made up of ducts and lobules. So the ducts are those tubes that carry the milk, which are produced in the lobules, which are the glands of that breast. And you have lobular carcinoma in situ. In situ means in place. It has not moved from where it has been formed. It doesn't move to the surrounding tissue. That's called LCIS. And then if you have that, it predisposes you to develop an invasive cancer in both of your breast. Ductal carcinoma in situ is also a type of primary cancer that it is still not invasive cancer. And certainly we know that something like 20 to 30% of women with low-grade ductal carcinoma in situ will actually, if it's untreated, proceed into developing invasive cancers. Then we have what is called early breast cancer. Early breast cancer would refer to cancers in stage 1 and stage 2. So a stage 1 breast cancer would be a cancer of the breast where the lesion, the mass, is about 2 centimeters or less in diameter, which is the size of a coin maybe.
Right.
And there may be no involvement of the nodes or the glands that are in the axilla or the armpit. So that would be stage 1. These cancers, like stage 2 cancers, which are slightly bigger cancers, but not beyond 5 centimeters. And those might involve some of the glands in the axilla, in the armpit as well. These 2 stages we know as early cancers are curable in most cases. However,
that's interesting.
However, when we talk about locally advanced breast cancer, when we talk about stage 3 breast cancer, where you have a much larger lump, and you have nodal involvement, glands under your arms and glands in other parts of your body might be involved. And we have some pictures of some of these kinds of cancers of the breast, and
we can put some of those up as you speak.
Those actually refer to locally advanced breast cancers. And in locally advanced breast cancers, whilst they are treatable, in most cases you cannot really cure them because of the extent of the cancer. And finally, we have something called metastatic breast cancer. And metastasis refers to the spread of cancer cells from the primary origin of the breast to other organs like your liver, your lungs, your brain, your bones, as in the case of breast cancer. And when they move to that point, we say that they are stage 4 cancers. And stage 4 cancers are not curable. Okay, they're not curable because you have persons who die of breast cancer do not ordinarily die from the primary tumor. They die from the metastatic tumor where that cancer spread and destroy their key organs.
Now, is it treatable? Is it treatable to the point where they can have, a good enough life for a certain period of time?
Well, certainly, each stage of cancer, there are, treatment goals. And in the early stages of cancer that I mentioned, your treatment goal is cure. Whereas in the later stage of breast cancer, stage 4 cancer, your treatment goal will probably be what is called palliation. And palliation involves managing symptoms and so on that improve your quality of life. So one of those symptoms could be pain. One of those symptoms might be, depression. One of those symptoms might be the lack of desire, and so on. So you want to manage those symptoms, and then you could either give medication, or you can have that person receive counseling, other interventions that are not traditional, conventional medicine, as it were.
Now, you said that most people present at stage 3. That means, when the cancer is in the first 2 stages, most people do not recognize it as cancer, and then by the time they recognize the cancer, it's too late. or it's getting too late?
Yeah. Well, I mean, I had some pictures here on the slides of patients that, you know, we see. You know, obviously, you know, the patient's identity is concealed here, but these are patients that we see in St. Lucia, and in the majority of cases, they're all advanced cancers. And I still can't answer as to why persons allow their cancers to develop into those, you know, that severity, so that, you know, by the time they get to us, that there's not so much that we can do towards a curative intent. We think that by increasing the awareness by these programs that we do, especially in October for Breast Cancer Awareness Month, that persons might take more interest in doing screening interventions like breast self-examination, you know, clinical breast exams by physicians, and mammograms, which are the three main pillars of screening, as far as it were, in healthy women, you know, for early lesions, detecting early detection of breast cancer.
Let's talk about men, because I brought it up a short while ago. Men are also susceptible to breast cancer. Talk a bit about that.
Yes, well, whilst we say that the lifetime risk for women for breast cancer is 1 in 8, for men it's 1 in 1,000. And we think that I have treated 2 men with breast cancer in St. Lucia, and certainly breast cancer can affect men. And we see that a man who has a family member, who has had a family member with breast cancer, actually has the same risk as a woman with, you know, if it's a genetic, you know, inheritance, that he has the same risk as other women with that same gene. And, you know, there's a particular gene that we've identified called the BRCA gene, and it codes for breast cancer. It increases the risk of having breast cancer if you have that gene up to 80%.
Wow.
Risk of having that breast cancer. So in some cases, when this gene has been detected in a lady who does not have breast cancer, a surgeon may recommend that that person should have what is called a prophylactic mastectomy. And in this case, you'd want to do a prophylactic bilateral. Both breasts are removed surgically, so that the tissue where breast cancer may develop no longer exists. And you know, you therefore prevent the development of breast cancer in these cases.
We're due for a break now, so let's take a quick break. When we come back, we'll continue our discussion with Dr. Owen Gabriel. We'll also take your calls on Newsmaker Live. I'm sure that you're burning to ask some questions about cancer, because cancer is still an enigma for many people, and we're hoping to demystify cancer so that more people can get treatment when they require it. So stay with us. Newsmaker Live will continue after this short break.